if the patient with lupus just has traditional cardiovascular risk factors, the answer we get will be about the same as if we just used the Framingham formula. But look what happens when we start to add lupus-specific risk factors or two lupus-specific risk factors. You can see now that the lupus-specific formula gives you that much higher risk, the real high risk that we know from our longitudinal data. So I think this is what's going to happen in the future. And then we're going to have to decide, once we know that we have a patient who has a particularly high risk, what are we going to do? Is it going to be low dose aspirin? Are we going to add statins early? We're going to have some practice guidelines to help. It's not enough to know that the person's at high risk. We have to decide together how we're going to treat high risk patients. Now, I want again to show you the example of comparing risk factors and the different formulas. You know, there's more than just a Framingham formula right now. The American College of Cardiology and the American Heart Association have a formula as well. So here's an example of looking at different risk factors and our cohort data and the American College of Cardiology answer. So again, remember, when you have multiple SLE related risk factors, you'll be able to show with a lupus specific risk formula that the patient's at much higher risk. Now, of course, there are limitations. I'm one center, Baltimore, one rheumatologist, me. These kinds of risk formulas have to be independently validated, and they might be slightly different in different centers. And of course, this reflects the follow-up that occurred in my cohort. And you could argue that perhaps patients seen right now might have slightly different follow-up over the next 10 years. But to conclude, a data-driven cardiovascular risk formula included 3 lupus-specific factors. You remember that was the overall disease activity, the lupus anticoagulant, and the low C3, things that we all know how to measure. They're available to all of us in practice. It also included 5 traditional cardiovascular risk factors. So I think it's so important to think about lupus cardiovascular risk in this way. It's multifactorial. The traditional cardiovascular risk factors and lupus-specific risk factors go into that formula. And as you now remember, well, it's not part of the formula because treatment isn't in these formulas, but prednisone increases the risk as well.